I ran across your name and your research because of a excellent paper in transplantation and cellular therapy that sort of it's a nice review of this whole topic of biomarkers and graft-versus-host disease. And you begin that paper by taking the reader through sort of the different types of biomarkers, in effect, organizing them by their functionality in terms of clinical use. So I think I think the framework here is 5 different types of biomarkers. So could you discuss those? I believe in the paper you talk about diagnostic, predictive, am I going to remember them all? Response, prognostic, and risk. So could you just give us a little one-on-one tour of those?
Right, it's the time frame is different for the different ones. So diagnostic is really easy to understand. Diagnosis is basically when you see the disease. So it's basically the marker will show an elevation, or sometimes it's also a reduction compared to the controls at the time of the onset of the disease, right? In this case, graft-versus-host disease or chronic graft-versus-host disease. So then a little bit more complex on the other ones. So predictive, this means you measure when you have the disease, but just before you start the treatment, right? And you can say what will happen to the patient, right? Even though your treatment didn't start yet. So, and response is you measure, so is linked, but is after the treatment started. So you see if it works or not, right? Then a little bit more complex on the risk. It's not that complex. It's risk biomarker. It's also called susceptibility marker. They are measured before the disease appear. So it's, if it's elevated, you're more susceptible to get graft-versus-host disease versus not. So that's what is risk. And prognostic is a little bit, so it's you measure it, but when you have a disease and you see what will happen in terms of fatality, mortality, and things like this, or severity, right? But really the important one are predictive and risk. Diagnosis somehow is a little bit less important because we see the clinical signs. Although we have shown that some of the biomarkers add to the clinical signs. So the really important one are predictive biomarkers and risk biomarkers.
And both of those types of biomarkers share an attribute of being a window into the future.
Correct. Yeah. So we measure, so for acute graft, maybe we need to say also what's the time frame of acute graft-versus-host disease. So after you get the transplantation, allogenic transplantation, so this is, we count this as day 0, the transplant is day 0. And acute GVHD is usually happening in the first 100 days. There are some exceptions, but that's the general thought. And in the current setting of transplant, it appears in 30 to 50% of the cases. So that's the time frame for acute GVHD, and the time frame for chronic GVHD is after day 100, and it can develop at 6 months, but also sometimes at 1 year or at 2 years. And chronic GVHD depends on the setting also in about 50% of the patient.